8:45, and hopefully everyone is warmed up by now after coming in from sub-zero weather. Can we have a roll call, please?
Commissioner Lloyd, Commissioner Winfrey,
Here.
Commissioner Ellenberg,
Here.
Commissioner Brown,
Here.
Commissioner Avery,
Here.
Commissioner Shoemaker, Commissioner Kuznow,
Here.
Commissioner Wayhill,
Here.
Commissioner Davis. We do have a quorum.
Okay, thank you. So this is the Community and Economic Development Committee, and can we have approval of the minutes?
Move it.
Support. It's been moved and supported. All those in favor say aye.
Aye.
Opposed? Motion passed. Are there any public comments to the committee? Going once? Going twice? Okay, no public comments, thank you. We do have communications next. Communities First. We have a representative here from Communities First, Joel Arnold, who is going to talk to us a little bit about the body of work that Communities First has been doing over the last year or so. And commissioners should have a one-page description of a summary of that work. But we're going to ask Joel to come forward and give us some details about all of the housing things that have been going on in Genesee County, thanks to Communities First. So Joel, take it over.
Absolutely. Well, good morning, commissioners.
Good morning.
Thank you so much for the time, Dr. Brown and everybody on the commission for letting us speak with you this morning. Yeah, we just wanted to come, provide a brief update about some of the work that we're doing here in Genesee County, and I think always to let folks know that our work is not just limited to the city of Flint or inner communities, but really across our county, because we know the need when it comes to the housing crisis and affordable housing for people across income levels is really broad. So a one-page document that the commission has before it this morning touches on a few developments that Communities First has finished in the last couple of years. So really to date, we've been really proud to bring online 221 units of housing in our county. That's worked out to about $60 million in investment. But we know that our county today is short thousands of units of quality affordable housing, around 7,000 just for people with very low incomes. So in the packet in front of you, there's a couple projects that we've noted. And of course, I want to highlight that the county and the County Metropolitan Planning Commission have been great partners on some of these developments as well, with support from things like home funds. But right on the border of Flint and Flint Township, we're currently working on what in total between 3 developments is going to be about 120 units of brand new housing, a mix of market rate, affordable, and some of the first housing in Genesee County explicitly reserved for formerly homeless veterans in partnership with the VA. It's called 3 developments right next to each other, Orchard Lane, which is a rehabilitation of a vacant apartment development, and then 2 new constructed buildings, Orchard Manor and Orchard Grove. And again, that's across the city of Flint and into Flint Township. Outside of those developments, we've been in the middle of an excellent process in partnership with the MEDC, the city of Grand Blanc, and other leadership there for a project right in downtown Grand Blanc, basically across from where the Garden Building is currently under construction, to bring online another couple dozen units of quality housing and some excellent new commercial space on the first floor there. We know we've seen a lot of investment in downtown Grand Blanc in the last several years to try and make it a more walkable community, a more welcoming community, and we've been thrilled to work with that community to bring that development together. It'll be about an $18 million investment in downtown Grand Blanc when we can get all those pieces together, and we're really excited about that. And then beyond that, up just north here of the river and a few blocks from where the county itself is going to be moving, the Marion Hall site where Odyssey House currently operates out of, we've been working on a development there to add 133 units of brand new housing here for our community, along with 20,000 square feet of retail space. And so those are some examples of some of these housing pieces. But the work has really gone beyond that, knowing that we can't just be building housing and nothing else, right? Housing isolated from opportunities, from jobs, or from services is what we did a lot of in the middle of the 20th century. It didn't work out so well. So our efforts have also extended to redeveloping the former Baker College campus in Flint Township, working with some excellent partners on that, and just not too far north of here on Hamilton Avenue, the redevelopment of the Community Enrichment Center, which some might remember as the Christ Enrichment Center or Christ Episcopal Church, into a really high quality community center in a part of town that's a little too far south of Burston to be in walking distance, but a little too far north of downtown to be in walking distance. So trying to add some nice amenities to these neighborhoods. But beyond kind of these pieces here, and I could really go on forever about this work, we just wanted to share some of the breadth of this work. We know the need is profound, and there's other excellent organizations in this county that are trying to tackle some of these issues, whether it's Habitat for Humanity or McFarland Villages or Uptown Reinvestment Corporation. But that some of the work that we've been trying to address is to make sure that folks here on the commission, we're a Flint-based organization and founded by Flint natives, just to know that, we have a lot of passion here for the city of Flint, but that we have a passion here for Genesee County. And our work goes across the county because the need to address the housing shortage is not one limited to one or two communities. It's one that we see all over the place, and it's why we're proud to be doing work in Flint Township and in Grand Blanc, and have been looking at opportunities in other places across the county to expand the scope of this work. So beyond this stuff, of course, we would always invite members of the commission to come to some of our programming, whether it's our African American film series that we do at the FIA every winter to highlight Black artists and Black filmmaking in our community, to come to events like Movies Under the Stars in the summer, our Community Candor Live series, which is a policy discussion series hosted at Factory One really throughout the year. But I just wanted to come this morning, provide this update a bit about what we're working on, ask for the continued partnership of the commission, which has been a wonderful partner now for years. And thank you so much for the time this morning.
Thank you, Joel. What questions do you have, commissioners? Okay, Commissioner Winfrey.
Joel, you mentioned Odyssey House. Are they shutting down their residential program?
No, they're not. Nope, they're working on relocating that to the Baker site, to one of the vacant dormitory buildings there. So they'll have brand new facilities for that program.
Oh, okay. Are they relocating to the Baker campus? Okay.
Commissioner Ellenberg.
Yes. I know there was a trade with the GHS building that's down by Hurley. Is there, what's the plans for that building?
I think we haven't determined anything yet. Specifically, I think we're looking at options for that site. For us, we certainly don't just sit on properties and not let anything happen with them. So it'll be redeveloped. I could very feasibly see something like housing there or some other service supports. Again, when the need is as great as we know it is in our community, and a lot of our specialty is really providing those housing units, that seems like a good possibility. But we're doing our due diligence to make sure that we do the right project.
Is there any way that you could get like a list of, because it says affordable housing, kind of what the starting price is for some of these facilities?
So I guess what I can say on that, and I'm happy I can send this up by email as well to members of the board. When we say affordable, what that means basically is that a tenant in those units won't spend more than 30% of their income on rent plus utilities. So we take the rent, consumers, water, all those fees, put them together, and based on them when a tenant applies, it depends on their income, but they won't spend more than 30%. So, it runs the gamut, but, in our senior development over at Oak, we have a lot of seniors just living on Social Security. So it's not uncommon to have tenants that are paying $260, $270 a month all in, because that's what they can afford based on the income that they make. But I can send you some of the income tables so you can see what that looks like.
Yeah, I would like that. And are they basically like a single person, family, or both?
Yeah, it runs the whole group. So we were just fortunate to have the grand opening for the Grand on University, right at the corner of University and Grand Traverse. And that's an example of development that has everything from, 1 bed, 1 baths to 3 bed, 2 bathroom units, because we know that oftentimes we see a lot of construction sometimes with just 1 bedroom units, but that families in our community are struggling to find quality housing. So adding those 3 bedroom units with multiple bathrooms to make sure that people can raise children in a quality house is something that we're also actively doing.
Yeah, I drove by the Grand University one. It looks, really nice, and that's kind of what I'm visioning for the old GHS building.
Yeah, and there's a lot of, it's close to a lot of public transit there, job opportunities at Hurley. It's a really great site, so we're excited.
All right, thank you.
Other questions? Commissioner Kuznow?
Yeah, so I'm gathering that most your development is redevelopment, taking existing buildings and remodel and repurposing or whatever, rather than building brand new. Is that correct?
Yeah, I'd say it's probably 70% rehab, but like the Grand that we just opened was brand new. Our Berkeley Place development on Ballinger Highway was brand new construction. So it's a mix. And our Orchard Manor and Orchard Grove developments that we'll be breaking ground on this year are 2 brand new buildings. But I'd say historically, it's been majority rehabilitation of vacant buildings.
Okay, thank you.
Commissioner Wayhill?
Thank you, Madam Chair. Welcome, Joel. Good to see you. Tell us what the vision is for the Baker the former Baker site? Because that's a huge piece of property, lots of buildings. What's going on there?
Yeah, so for us, really, a lot of that work has been to, we've had a lot of way it's developed has been a lot of social service agencies in our communities have been operating out of some really older, dilapidated facilities that are many decades old. And so whether it's GHS or our partnership with Odyssey House, or even Communities First now has some offices out in that space, and other partners that we've been talking to, is to try and make sure that the site, A, provides quality services for people who need it in a lot more modern facilities that we see. The nice thing, at least, is that a lot of the facilities that Baker built on that site were not that old. Some of the dormitory facilities there are only maybe 20, 30 years old tops, and we're in pretty good condition. So we see as a space for a lot of social service providers, rentable office space for community organizations. We're working on taking what was formerly the East Dormitory building, and again, it's already a dormitory building, so making that into more housing. So we see it as a mixed-use campus where you see office space, social services, housing, all kind of in the same space. But yeah, it's 42 acres and 7 buildings, so it's kind of like eating an elephant on that project. You do it one bite at a time. But we've been fortunate to, by now, between some of these agreements that I've mentioned, at least the majority of that campus already has a new active use assigned to it with a partner organization.
Thank you. And then the Orchard project, which I guess has 3 components, sounds like. What's the timeline on that? And I know you said Flint Township in Flint. Tell me exactly where it's located.
So there is, if you're going down Flushing Road towards Ballinger Highway, before you get to Ballinger on the south side, there's a large empty lot. Used to be a medical arts office building there. Yeah. So basically that lot is the split, the Flint Township border runs down the middle of that lot. So that development is that rehabilitation of the existing 45 units of housing that sit there just across from the post office. That's under construction today. And our hope is it's 4 buildings. Our hope is to reopen 2 of those within the next couple of months and continue work on the other 2. And then for Orchard Manor and Orchard Grove, which are the 2 brand new construction, again, would be a groundbreaking within the next few months. It's, it can be tough to do a groundbreaking in January, but we're wrapping up some final closings on that, doing appropriate environmental reviews for the site to make sure it's healthy for folks. But those are ones that, you can go over to Orchard Lane today and see construction, and then Orchard Manor and Grove sometime here in a couple of months.
Yeah, I'll just finish, Madam Chair, with a compliment to Joel and to Glenn and Essence and others for all the work that you've been doing, especially in the housing sector. The college where I work full-time had a housing summit, as you know, because you were one of our speakers, and the chair was there as well. And there's a crisis in our community around housing in a lot of different ways, affordability, availability, et cetera. And so the work that you're doing, from my perspective, is wonderful and appreciated. Thank you.
Thank you so much.
Thank you, Joel, and thank you for coming early this morning to do your presentation, especially I know since it was kind of a last-minute thing.
No worries.
And we will probably ask you to come back later on to answer some additional questions about the partnerships, because I think what's fascinating about what you do is you have this magical ability, it seems like, to bring together so many partners in order to implement the plan and the vision. And so I wanted the community members to know, whenever you see shovels and dirt and bricks going up around the community, it's good for them to know what kinds of projects are going on around the county. So thank you for your work.
Thank you so much for having me this morning.
Okay, next on the agenda, we have the Community Mentors Grant. This is a grant that we applied for back in October through the Federal Home Loan Bank of Indianapolis, and it was applied for on behalf of District 4, which includes Mundy Township, part of Flint Township, Grand Blanc Township, and the 8th Ward in Flint. And the grant actually involves the mentoring by other economic development specialists. And so we found out on December 20th, so it was a really nice Christmas gift that we actually got awarded the $50,000 grant in order to put on a conference, a symposium, if you will, on April the 22nd of this year. And so more information will be coming to this committee about what will actually take place on that day. The next thing on the agenda is the University of Michigan Flint Partnership. And we have a partnership, a MOU that was signed, as you recall, back in November. And just recently at the last meeting, we came up with a format for staff members at U of M and staff members at the county to actually apply for these joint partnerships, which is designed to leverage resources. And so we just wanted to make you aware that this form is just a two-page form that will be available in Google format. And the selection criteria will involve projects that address the county's priorities and that responds to questions the county is seeking answers to, but perhaps we have lack the capacity to pursue. It's going to focus on projects that add value to data-driven decision-making by county officials. It's going to approach projects that will inform our understanding among residents, projects that inform policy decisions that can help drive growth, quality of life, and economic stability. The projects will assist the county's work in a timely manner, and the projects will help shape educational value for students. And so those are the kinds of projects we're seeking to come forth to the committee over the next several months. And of course, they will be accepted based on capacity and feasibility for implementation. So just wanted to make you all aware of that. Is there any old business for the community? No old business. Any new business? We do have one resolution here. Resolution for an approval of an agreement between Genesee County and ERG Environmental Services in an amount not to exceed $128,000 to provide for services related to the 2024 Recycle Day events. The cost of this agreement will be paid from account 2321-735-8720.
I'll move it.
Support it.
It's been moved and supported. Is there any question and discussion? Okay, all those in favor say aye.
Aye.
Opposed? Motion passed. Any other business before the committee?
None.
All right, we are adjourned at 9:01.
Yeah, feels good. I Okay, I call the Finance Committee to order at 9:03. Roll call, please.
Commissioner Lloyd, Commissioner Winfrey,
Here.
Commissioner Ellenberg, Commissioner Brown,
Here.
Commissioner Avery.
Here.
Commissioner Shoemaker, Commissioner Kuzinoff.
Here.
Commissioner Wayhill,
I'm here and seriously outnumbered.
Commissioner Davis. We do have a quorum.
Okay, I need approval of the minutes.
So move.
Support.
Is there any comments or questions? Seeing and hearing none. All those in favor?
Aye.
Opposed? Motion passes. We don't have any communications, no old business, new business.
Mr. Chair, I think you skipped public comment.
Yes, I did, I'm sorry, thanks. Is there any public comment to the committee? Is there any public comment to this committee? Yes. Let's step up to the mic, please. Just state your name and city, and you have, what, 2 or 3 minutes? 2 minutes.
My name is Jackie Redmond. I live in Flushing. I'm here to show support for Genesee County Animal Control. I'm a volunteer there, and I know there has been some things being said and some complaints being said about some employees and how things are run at the shelter. And I don't know if you can see behind me, but most of us are here to show our support and say that how wonderful the building is, how wonderful the staff are. I had a lady come down from Bay City yesterday, and she raved about how clean our building was, how nice it was, how everybody that she encountered during her adoption was amazing, and she would highly recommend our animal control to anybody that she could talk to. I don't know what else I can say, but I, welcome any of you guys to come down and check us out. We put our heart and souls into the animals, into the staff. We're a family. We may be dysfunctional, but we are a family. We all work together and want to do our best for these animals and for the community. So, thank you.
Thank you. Is there anybody else that wishes to address the committee? Anybody else? Yes. Yeah, come on up, just step up.
Hi, I'm Beth Hansen, Jefferson Boulevard, Grand Blanc, Michigan. And I've been a volunteer at the shelter for 10 years. And I can tell you the leadership is awesome now compared to I've seen leadership in the past. Like Jackie said, we're all a family, we work together. The animal care is top notch. There's things that get done now that didn't get done in the past. Danielle stays on top of everything, dog evaluations, the quality of care is very well done. And Facebook can be a platform for people to share their concerns. I can tell you that the concerns that were out there recently were former, probably disgruntled volunteers, and even though I love them, that's not the space and the place to bring your concerns. It's here, so it's unfortunate that that happens in the public. But as far as I'm there 2 to 3 days a week, I see everything that goes on, and can tell you that it's being very well run. Thank you.
Okay, thank you. Is there anybody else that wishes to address this committee? Yep, just step up.
My name is Glenda Dixon, 5292 Linden Road, Swartz Creek. I'd like to say that I've been there for 5.5 years. I am a dishwasher. I am in an area where a lot of new walkers walk by the dishwashing room and they stop and ask me questions and I try to answer them. Or they come to me about questions about a dog and I send them to the staff. Staff will stop what they're doing to go see about the dog, to go see what the walker's concern is, because they really care about these animals. They always have and always will. And the new management is absolutely excellent. Thank you.
Thank you. Is there anybody else that wishes to address the committee?
My name is Kathy Verdin. I am from Heartland, Michigan, and I drive up from Livingston County to volunteer in Genesee County. I've been here almost 2 years. In the 2 years that I've been here, I have seen such great improvements with the new deputy director. I have extensive volunteer experience in not only animal rescue, but other forms of volunteer across different areas. And it's probably one of the most well-run volunteer programs that I've been a part of. The people, the staff, the volunteers at GCAC are some of the most compassionate people that I've ever met in my life. For the staff, it's not just a job because they don't get paid nearly enough to do what they do. And I know that I couldn't do what they do. And it's more than a job, it's their passion. They go above and beyond, not just during work hours, but they go, come in early, they'll stay late. I mean, I can't say enough about the staff and the volunteers. And again, even just in the past 2 years since I've been there, the improvements that I've seen, the openness to hearing like, you know, ideas and respect and respecting other people and collaboration to improving work environment, not just for the staff, but ultimately for the animals. It's just, it's again, it's just, it is remarkable to me that that much love and compassion and commitment goes into what they do. I will say, add on to what somebody said, it's very unfortunate to me that there's some past disgruntled volunteers that have put their ego ahead of the care of the animals. That's really disheartening to me, but I would just rather focus on the amazing job that the current leaders are doing and the current staff are doing, and I just really want to applaud them. And like somebody else said too, I welcome any of you to come in there any day of the week and see what's going on with the animals and the care that they're receiving at the shelter. Thank you.
Thank you. Is there anybody else that wishes to address the committee at this time? Is there anybody else? Yes, go ahead.
Hi, my name is Brenda Kramer. I'm from Grand Blanc. I've been volunteering about 4 to 5 years, and everything at the shelter is done it's for the health and the safety of the animals and their welfare. And all the staff, the volunteers, they put the animals first. And when people go out, like on the Facebook, it can be a very good source of helping find animals, everything like that, but just to put things on Facebook that it doesn't help. If you have an issue with animal control, you should be coming to the director, deputy director, the staff, and if you have any concerns, talk to them. It's not about putting on Facebook. Facebook is just somewhere people just talk, to just get on Facebook and nobody knows who they are. So I just want you guys to know how much what they do for the animals, and they put the animals first. And there was one lady, one of the staff, Leah, that they called out on there, and she's probably the most compassionate person I know. When I first started there, if I had a question, she would drop everything to help me. So I just want you to know that everybody there just loves everybody. They love the animals. The animals are first, and the staff and the volunteers all work really hard to make it a good place for the animals so we can give them forever homes, get them away from the horror that they've experienced in some of their short lives. And just, I don't know, it's very sad to see what people do to try to corrupt something and make things bad, but it is a wonderful place and they're doing great things for the animals. And I just want you guys to know that. And if you have any questions about the shelter, come see it. Come talk to people. Don't follow social media. Don't look at that stuff. So, and really, I think that's all. I just want you to know that everybody at the staff and the volunteers all love the animals, and they just want them to have a good life, and that's what matters. Thank you.
Thank you. Is there anybody else? Yes, go ahead.
Hi, so I'm Jennifer Hubble. I am a staff member of GCSE. I had the privilege of meeting Dr. Brown the other day. Got to see you before you toured our facility. I was a customer for GCSE long before I was a staff member of GCSE. I had the privilege of meeting wonderful volunteers in my time there and also meeting staff members that I now work with. I also had the privilege of losing my dog there as well. And before I was a staff member, I had the choice to go to my vet or go there. The amount of people that I met along the way and the amount of support that I got with my own dog before I even worked there as a staff member was phenomenal. And I did have the ability to say goodbye to my dog there with great compassion. I now work there. I love what I do. It's stressful. It's chaotic. You get bashed by people for no reason, but we're strong. We're a team. We're here. I have so many people supporting us, staff, volunteers, ACOs, people from other places coming to support us. We're here for the dogs. We're here for the cats. We're here for all the other critters that come through there. We had a pig, for Christ's sakes, for 2 days. Who else would say that? We do it. We kept the community safe. We have the animals safe. That pig went home. Every animal we go through, we treat with care and respect. And I've seen a lot of other facilities. I got euthanized training out of our facility in the west side of the state. Our shelter is superior to theirs. Our cleanliness, our team, our staff, the new building, our cages, everything we have is phenomenal. And I've seen multiple shelters. We have a great team, a great staff, great volunteer, and we do have really well-rounded animals. Thank you for listening.
Thank you. Is there anybody else that wishes to address the committee at this point in time?
My name is Mark Krantz, and I live in Mount Morris Township. I've been a volunteer at Genesee County Animal Control for 11 years. Just want to say that I have support for Jay, for Danielle, for all the staff, for all the veterinarians. I have toured Bay County, Lapeer County, and Livingston County animal shelters, and I tell people that come in to adopt cats and dogs, they can be proud of this shelter, not because of the new building or the policies, but because of the people and the staff. Thank you.
Thank you. Is there anybody else that wishes to address the committee? Is there anybody else? Third time, is there anybody else? Thank you for everybody coming out and making your comments. Okay, now we can move on to new business. Resolution 24-18, enter into an agreement with Centis for mat replacement and other services in an amount not to exceed $34,738.65.
I'll move it.
Support.
Is there any discussion? Seeing none, all those in favor?
Aye.
Aye.
Opposed? Motion passes. Resolution 24-002, approval of a request to create, post, and fill 4 interim positions at Genesee County's Information Technology Department to be paid from the following account and related fringe accounts.
I'll move it.
Support.
Is there any comments or discussions or questions? Seeing and hearing none, all those in favor?
Aye.
Opposed? Motion passes. Resolution 24-004, approval of a request to create, post, and fill 1 user support technician at Genesee County's IT department to be paid from the following account.
So move.
Or,
Does anybody have any comments or questions? Ms. Ellenberg.
Is the IT director here?
Welcome, Mike.
Okay, good morning. I see that you have some positions. Are we getting close to filling all the positions that you have available?
Very close.
Okay. That was kind of like your goals to make sure that you had a working team.
Been a struggle, but yeah, we're very close. There would be one more contractor we're looking for, and that'd be it.
And is everything going as planned as what you would, when you first got here? Is everything rolling the way it should?
Things are improving profoundly, if I may say. But as planned, I have high, lofty goals. So not quite as great as I would have wanted, but we're getting there.
So will this be a team when we move to the new building that will be able to transition that from here to there?
Yeah, that's one of the larger things that are looming over us in terms of projects and how critical we believe it's going to be for to be successful. Yes, very much so.
Okay, all right, thank you.
Does anybody else have any questions or comments for the IT director? Seeing and hearing none, all those in favor?
Aye.
Opposed? Motion passes. Resolution 24-005, approval of a purchase order for various vendors for the fiscal year ending 2024 in an amount not to exceed $1 million, $2,500 to provide for the purchase of pharmaceuticals at Genesee County's Health Department. The cost for this purchase will be paid from accounts listed.
So move.
Support.
Is there any comments or questions of the Health Department? Seeing none, all those in favor?
Aye.
Opposed, motion passes. Resolution 24-006, approval of a purchase order to various vendors for the fiscal year ending 2024, an amount not to exceed $275,500 to provide for the purchase of medical supplies at Genesee County's Health Department. The cost of this purchase order will be paid
So
from.
moved.
Support.
Is there any comments or questions? Seeing and hearing none, all those in favor?
Aye.
Opposed, motion passes. Resolution 24-009, approval of a request to create, post, and fill one secretary position at Genesee County's Health Department. This is grant funded.
Support.
Any questions or comments? Seeing and hearing none, all those in favor?
Aye.
Opposed? Motion passes. Resolution 24-010, approval of a request to create, post, and fill one public health nursing supervisor position at Genesee County's Health Department.
So move.
Support.
Anybody have any questions or comments? Hearing and seeing none, all those in favor?
Aye.
Opposed? Motion passes. Resolution 24-013, approval of an agreement between Genesee County and Complete Corporate Solutions in an amount not to exceed $85,000 to provide for staffing of a data center engineer. The cost of this agreement is to be paid from the following account.
So move.
Support.
Any comments or questions, Dr. Brown?
Can someone, can Mike come back up again and kind of give us an idea of what a data center engineer does, what the expectations are?
This is the highest level non-managerial position we have that manages our Windows environment, more or less. This is the person who coordinates how Teams works with SharePoint, works with our servers, and how people interact with those services.
And I noticed that we've been looking for a qualified person over the last 18 months.
Now it's been vacant for 18 months.
What do you think the challenges are in finding a qualified person?
Multifold. The lowest hanging fruit would be, well, are we paying enough? That's always the go-to thing, and I'm not convinced. I think pay could improve a little, but I think people choose where to go based on a lot of factors. Sometimes the region, maybe the commute, how long it takes to get there, multiple factors. We've been doing everything to make this place a more attractive place to come to. We have parties, potluck stuff. We take pictures. Look what a family we are, that kind of stuff to sort of, hopefully, all of us are sort of weighing in on this. And HR is doing the same thing. Fiscal is doing the same thing. That this is a great place to work. People just got to know it. And I don't know if that many people know it. And I believe that's one of the bigger problems we have is we're not attracting people based on that kind of thing. That, it's a pretty good place. It's not that bad. Come here, try it out. So the tack we're taking now is through a contractor. We've got someone out there making phone calls every day, headhunter. And that's the tack. The last time we had this issue, we had a previous one, the same thing, similar occasion. We had him on for a 6-month contract, and then, will you stay on permanently? He did. So now he's a permanent employee. It's a way to get somebody in.
Okay, thank you.
Does anybody else have any questions of the IT director? Thanks, Mike. Seeing none, hearing none, all those in favor?
Aye.
Opposed? Motion passes. Resolution 24-019, approval request to, I'm sorry, I missed 2014. Let's go back to 2414, forwarding to receive and file a copy of the paid county bills for the weeks ending 11/12/23, 11/19/23, 11/26/23, 12/3/23, and 12/10/23 in the amount of $23,498,013.88. I'm sorry, I know you guys made the motions and et cetera, but some people like to hear that full amount, and I'm one of them. So I continued with that boring thing. But is there any comments or questions? Seeing and hearing none, all those in favor?
Aye.
Opposed? Motion passes. Resolution 24-019, approval of request to create and post and fill 3 seasonal positions at Genesee County's Park and Recreation Committee.
Support.
Any comments or questions? Seeing none, all those in favor?
Aye.
Opposed? Motion passes. 24-020, approval of a request by Genesee County's Park and Recreation
commission to travel to the 2024 Keep America Beautiful National Conference in San Diego. The dates of travel are February 12th through the 14th in this year. The total cost for this travel is for one staff member not to exceed $2,500.
I'll move it.
Support.
All those in favor? Or, I'm
Aye.
sorry, do we have any comments or questions? Hearing and seeing none, all those in favor?
Aye.
Motion opposed? Man, I'm losing it here. At any rate, the motion's going to pass. Resolution 2427, approval of request by Genesee County's Parking Commission to travel to the 2024 M Parks Conference and Trade Show in Kalamazoo, Michigan. The dates of travel are February 27th through March 1, 2024. The total cost for 6 employees is $7,200. The cost of travel will be paid from account following.
I'll move it.
Support.
Is there any questions or comments? Seeing none, all those in favor?
Aye.
Aye.
Opposed? Motion passes. Resolution 24-029, approval of a purchase order to Vigilant Solutions LLC for the fiscal year ending 2024 in an amount not to exceed $33,090 for the purchase of 2 mobile license plate reader systems. The cost for this purchase order will be paid from the following account.
So move.
Support.
Is there any questions or comments? Seeing and hearing none, all those in favor?
Aye.
Opposed? Motion passed. Resolution 24-052, approval of a proposed budget amendment to the 23-24 appropriations resolution for various line items as described in the attached budget adjustment request.
So move.
Support.
Is there any comments or questions? Seeing and hearing none, all those in favor?
Aye.
Opposed? Motion passes. Resolution 24-053, approval of a request from Genesee County's treasurer to borrow against the anticipated delinquent 2023 real property taxes.
So moved.
Support.
Is there any comments or questions? I just want to make the comment, this is a yearly thing, so at any rate, all those in favor?
Aye.
Aye.
Opposed? Motion passes. Resolution 24-083, approval of a request to create, post, and fill 1 full-time financial analyst 2 position to be paid from the following account and related fringe
move it.
accounts.
Support.
Is there any comments or questions? Dr. Brown?
And looking at this, I think it's a brand-new position. Is that correct?
It is, yep. Crystal can come up and speak to it.
Good morning.
Good morning.
Morning.
This is actually upgrading a position, so it's eliminating a financial analyst position and then creating a financial analyst 2. And it's adding additional requirements to that position because it handles a lot of grant work with the health department. And so some of the expectations that we were seeing from them were higher than what the other analysts were required to do. This will help us in recruiting to keep somebody there that's actually very competent in grants, to help that program side work together with the finance team.
Okay. And in the job description, I noticed, since it was a brand-new job description, it was missing the DEI statement that we really need to have on every single
I'll work
job
with
description.
HR to get that added.
And so, yeah, I just want to make sure that is listed on every single job description, especially if it's brand new, because personally, I won't be approving any other new job descriptions unless it has that statement on it.
Okay.
Thank you.
Is there any comments or questions from anybody else? Hearing and seeing none, all those in favor?
Aye.
Opposed, motion passes. Before you all should have a request to add another resolution, so I'd like to read that and then looking for a motion and support. But be it resolved by this Board of County Commissioners of Genesee County, Michigan, that the request by the Director of Planning to authorize approval of the allocation of $1,600,000 of Genesee County American Rescue Plan, ARPA, funding for accounts through various line items there for Genesee County Senior Citizen Capital Improvement Projects, and to approve a budget adjustment along with this request with no additional general fund appropriation needed. Do I have a motion?
So moved.
Support.
Is there any comments or questions by anybody?
Mr. Chair, just a question about the motion. Is the motion to add it to our agenda?
Yes, at this point in time.
Okay,
yeah.
thank you.
Okay. Without any other questions, I have to do a roll call, don't I? Okay, all those in favor?
Aye.
Opposed? Motion passes. Okay, now I need a motion.
I'll move the resolution.
To approve it.
Support.
Any other comments or questions at this point in time?
Mr. Chair, if I could.
Yes.
For the folks in the audience and the folks at home, the commission has been discussing this in study sessions for a while now, and I'm in full support of granting up to $100,000 to each of our senior centers in the county so they can do capital improvements, infrastructure improvements, furniture if they choose to do so. Our senior centers are a really vital resource for people in this community. And I've only been on the commission for a year, but I have come to greatly appreciate the senior centers in my own district and have had a lot of contact with them. I know that they have needs, and I know that we have some dollars that we can put towards those needs. So I'm happy to support this. Thank you.
Thank you, Commissioner Wayhill.
Commissioner, I'd like to add to Mr. Wayhill, and too, want to commend the board of looking at efforts to disperse our dollars to each of our districts. I think that was very important to show that we are intent on making sure we have dollars for all districts, and this is one of those facets. So I'd like to just thank the board for their efforts in that.
Thank you, Chairman Avery. Thank you. Is there anybody else? Yeah, I fully support this myself. It's a great way to disperse the some of this money in a very meaningful way, a way that will help a large segment of our population, and those senior citizen centers are well used. So without any further comments, all those in favor?
Aye.
Opposed? Motion passes. There is no other business other than I would personally like to thank the public for coming out and speaking up concerning the animal control system and building. I've been here on and off since 2016, and I've seen vast improvements. What I am totally impressed with is the passion that you volunteers have for what you do. And, you know, hearing many of you, I didn't know any of you personally, but throughout the years in my other career in the healthcare sector, I've met a lot of the volunteers, and I can't believe the passion that they have for doing what they do. And I appreciate you guys coming up and speaking today.
Commissioner?
Yes.
Can I add to that?
Yeah.
Please. As was mentioned, I had a chance to visit the Animal Control Center last Wednesday, and you know, as a researcher, I try to look at multiple sources of data before I make a decision, and there's something called triangulation of data. And so, in my mind, after I read all of those emails, pros and cons, on social media, I decided to go and check it out for myself, because there's nothing like seeing something and understanding it before you make a decision. And so between triangulating the data of my site visit, the data that I looked at, and reading all those emails and listening to the testimonies today, I am absolutely convinced that the naysayers have been looking at an anomaly that has happened, and 99.9% of the work that goes on at our Animal Control Center is superior. And I just want to say that you can let social media consume you, but it only consumes you if you allow it to consume you. The thing that matters is what is going on in the building with the passionate people, and thank you so much to the volunteers. I saw the passion, I felt the passion, and I believe in everything you do. Thank you.
All right. I now adjourn this committee at 9:34.
All right. Governmental Operations Committee is called to order at 9:38. Can we have the roll call?
Commissioner Lloyd, Commissioner Winfrey. Here. Commissioner Ellenberg.
Here.
Commissioner Brown.
Here.
Commissioner Avery.
Here.
Commissioner Shoemaker. Commissioner Kuzma.
Here.
Commissioner Wayhill.
Here.
Commissioner Davis. We do have a quorum.
Thank you, Mr. Freeman. I'll entertain a motion to approve the minutes from November 29th, 2023.
Support.
We have a motion and support. Is there any discussion? All those in favor, please signify by saying aye.
Aye.
Any opposed? Motion is carried. Do we have any public comment to the Governmental Operations Committee? Any public comment? All right, public comment is closed. Do we have any communications?
No, sir.
Do we have any old business?
No, sir.
Under new business, we have Resolution -2023-909, approval of a contract between Genesee County and Genesee Health Systems in an amount not to exceed $47,145 to provide services for Genesee County's mental health court. The cost of this grant-funded agreement will be paid from account ending in .004.
So moved. Support.
It's been moved and supported. Do we have discussion on the motion? All those in favor, please signify by saying aye.
Aye.
Any opposed? Motion is carried. We have Resolution -2024-001, approval of Tri-Share Program in an amount not to exceed $150,000 to provide for a trial child care program for Genesee County employees.
Move it with a question.
Support.
It's been moved and supported. Commissioner Kuzno.
Could I just have a more detailed explanation? of
Yep,
what
Danielle,
this-
our Deputy Director in HR is coming up to answer your questions.
Yeah, okay, exactly. What are we providing and where?
Sure. So this is a program, it's a pilot program with the state of Michigan to assist with childcare costs. So we would be, the share is split between the employee, the county, and the state.
So there is some grant money there.
No, this would be general fund.
What's the state have to do with it?
This is a pilot program that's being put on by the state of Michigan to assist with reducing the barrier for people for access to childcare.
All right, what are they providing then? Just advice?
So they actually
No money?
facilitate, so the nice part is for the employer, so we cover 1/3 of the cost of the childcare for the employee, but there's no heavy lifting for the employer. The state of Michigan has something called the Hub, which facilitates the program for the employer.
Commissioner, the state of Michigan pays a third of the, so if the child care is $100, we're paying 33, the state's paying 33, and the employee will pay
Okay, that's what I
33.
wanted to know, and that's
Yep.
what I thought. I just wanted to hear it, that's
Yep.
all. Okay, thank you.
You're welcome.
Commissioner Ellenberg.
Yes, and so this will be the child care program, where will it be held? It would be like part of wherever they take their child to take care of?
Correct, yes.
So they'll get reimbursed 33 or a third of that?
The
person?
employee?
Yes.
No, so the employee would pay their childcare provider 1/3 of the cost.
Okay.
And then the state would pay a third, and then Genesee County would pay a third.
Okay, and how long is this program?
I'm not sure on that. This is a pilot program through the state of Michigan, similar to like the work share program that we had a couple
And
years
then
ago.
we'll have basically reports on how it's going?
Yes, we can
Yes,
provide
yes.
that by the end of the fiscal
Yep.
year.
Okay, all right, thank you.
Do we have other comments or questions on the motion? So just a question for me. The $150,000 is the Genesee County share, is that right?
Correct, yes.
So in theory, if the maximum number of employees participate, that's $150,000 from employees and then $150 from the state?
Correct, yes,
Okay.
they match.
All right,
The
thank you.
1/3.
Sure. Commissioner Kuzno.
So I would assume then, at that point in time, if it started to exceed that 150, that's when, what would happen?
So that's the-
The program would come to an end, or you
Cor-
would provide reports, or what?
Correct, yes. Yep, so that would be the amount funding up to, because this is a pilot program, we're not sure what this would cost, so that's just the amount that we put in, kind of expecting and talking to the state, like what it would cost per employee per year to kind of try out this pilot program.
Hopefully it's for a full year.
Correct, yes.
Any other discussion? So
We actually surveyed staff and asked about whether or not there'd be interest in these types of childcare services or partnerships, we got a number back and we base the initial funding on that number. We won't know who's going to participate until we start to roll that out, but we'll keep track of that over the year, and then we'll be able to decide moving forward whether it's something that the county can continue, whether the state's even going to continue the program or not. But we wanted to get it pre-funded through this fiscal year and see what the results were.
Commissioner Ellenberg.
Yeah, I just have one more question. So will this be like a certified childcare facility?
Yes, completely licensed. And they don't have to switch providers as long as they're licensed by the state.
Okay, that's what I was wondering. It was like if
Yeah.
grandma's watching the kids.
Nope, they have to be a licensed provider through the
That's what I
state.
want to
Yep.
know. All right, thank you.
You're welcome.
Any other discussion? I'll just add that we've spent a lot of time, at least in my first year, talking about trying to attract new employees, retain employees, improve morale. We've got the new organizational development position, which is designed to do that. And then this, of course, is an additional benefit for employees, and hoping that they'll come here and continue to work for us and be happy, productive employees. So thank you for putting it together.
Thank you.
All those in favor, please signify by saying aye.
Aye.
Any opposed? Motion is carried. We have Resolution -2024-016, approval of an agreement between Genesee County and Warner Norcross and Judd LLP in an amount not to exceed $60,000 to provide lobbyist services on behalf of Genesee County. The cost of this agreement will be paid for from account ending in .004.
So moved.
Support.
It's been moved and supported. Do we have discussion? Commissioner Cousineau.
I'm in favor of hiring a lobbyist, but I've never seen any feedback as to, what they're doing, what they've accomplished, nor have I had any contact with them. Are you the only contact with them, Josh?
They kind of coordinate things through us, but I think the feedback or the results of their work, we can point to, right? They were very helpful in that $3 million from the prosecutor's office. They've done some work with water and waste. There's some stuff coming up this fiscal year as well that they're working on. So I can get them in here and we can have maybe a workshop day, include that as part of one of the workshops.
Okay, thank you.
Commissioner Ellenberg.
And, Mr. Chair, is this the same amount as we paid last year?
Yeah.
Okay, all right, thank you.
Commissioner Brown.
How long have we used them? Has it been just last year for the first time?
Yeah, so I've been here, this will be, I think, my 8th year here, and last year was the first year that the county had engaged with the lobbyist.
Okay. And this particular motion is for the end of this year, correct?
This fiscal year, so this would be through September 30th.
Okay. If the data come back and they indicate, high levels of performance and outcomes, I would ask that we consider a multi-year contract next time, and perhaps we can get a better negotiated rate for a multi-year contract.
Sure.
All right, any further discussion on the motion? I'll just say that I'm really happy that we got that $3 million to support the prosecutor's operation. And there's no doubt in my mind that a big piece of that was this firm in the form of Burton Brown lobbying on our behalf in Lansing. So all those in favor, please signify by saying aye.
Aye.
Any opposed? Motion is carried. Resolution 2024-059, approval of a request by Genesee County's Office of the Prosecutor to travel to the Carpal Solutions User Group meeting in St. Louis, Missouri. The dates of travel are April 2nd through the 4th, 2024. The total cost for 5 employees not to exceed $10,000. Funding for this travel will be paid from account ending in .004.
So moved.
It's been moved and supported. Is there discussion? Commissioner Brown.
I just had a quick question. What is our policy on per diems? Anybody know?
Yeah, it's in, I think it's $30 a day, something like that.
Yeah, it was 30 or 35.
Yeah, it's $30 a day.
Because I think this calculates to $90 per day.
They won't be paid for more than $30 a day. That's what the policy is. So.
Any other discussion? We do have Mr. Potbury, who is able to answer any questions, it appears, if you have any. You want to introduce yourself real quick, John?
Yeah, good morning. Thank you, Mr. Chair. John Potbury. I know all of you sitting here, except for the gentleman behind the monitor there. But it's a pleasure to be here. Happy to answer any questions regarding this request.
This gentleman is the most important person in the room right now. I
have
want you
no
to know
doubt.
that. Alan. Any questions or comments? Anything for John or on the motion? All right, all those in favor, please signify by saying aye.
Aye.
Any opposed? Motion is carried. Do we have any other business for this committee? All right, committee is adjourned at 9:49. Thank you.
Moving right along, we're going to call the Human Services Committee meeting to order. Roll call, please.
Commissioner Lloyd, Commissioner Winfrey.
Here.
Commissioner Ellenberg.
Here.
Commissioner Brown.
Here.
Commissioner Avery.
Here.
Commissioner Shoemaker. Commissioner Kuzma. Commissioner Wayhill.
Here.
Commissioner Davis.
Right, at this time, the chair will entertain a motion to approve the previous meeting's minutes.
So moved.
Support.
Properly moved and supported. Any questions, comments? Hearing none, all in favor, aye.
Aye.
Opposed, nay. Ayes have it, motion carries. Are there any public comments to this committee? Any public comments to this committee? Any public comments to this committee? Hearing none, public comments are closed. Communications, none. Old business, none. New business, Resolution 2024-011, approval of an agreement between Genesee County and the Greater Flint Health Coalition in an amount not to exceed $500,000 to provide Medicaid outreach services. The cost of this agreement will be paid from account ending in 001 with a 50% reimbursement from Medicaid.
I'll move it.
Support.
Properly moved and supported. Any questions? Hearing none, all in favor, aye.
Aye.
Opposed, nay. Ayes have it, motion carries. Resolution 2024-015, approval of an agreement between Genesee County and the Greater Flint Health Coalition in an amount not to exceed $221,930 to provide for an examination of emergency medical services in Genesee County. The cost of this agreement will be paid from the following account.
So moved.
Support.
Properly moved and supported. Any questions?
Mr. Chair.
Commissioner Wayhill.
Thank you, Mr. Chair. I know that we've discussed this in study session format, and I think there's obviously consensus that this is necessary. I'm wondering if there is someone who could talk about it in more detail. My experience is on issues like this that if we simply vote on it, people will take to Facebook and say things that aren't quite right. So if there's anyone,
Yeah, well, we have the esteemed
Thank you.
Senator Jim Ananick in the audience. If he would come forward, please.
Then he brought his staff who knows what's going on.
all of that was to say that I saw Jim sitting in the back earlier, so.
Okay, that was your reason. Okay.
Thank you, Mr. Chairman, and thank you, everyone, for having us. I can talk a little bit about it. We also brought some folks with us.
Brought your back up.
That would be preparing the study. Obviously, this is an issue that you guys have worked really hard on and have dedicated yourself to solving and making sure that the residents have an adequate EMS system in place. And instead of conjecture and all the other things that are happening, you want to get to the bottom of it. You want to find out where the flaws are at, where the strengths are at, and where holes may be and how we can fill them. So I have Nicole here who works with me, who can talk a little bit more in detail about some of the things we're providing, and we have some of the people that we're going to be working with as well to make sure they're here to answer any questions. I appreciate the questions. I think it's important to make sure that all of you have an understanding of how detailed this will be, how thorough it will be, and how research-based it will be to make sure that you have a solution based on data, which is what you all want.
So I'm kind of acting as the coordinator of this project. So one thing the Health Coalition does well is we like to be neutral, and we also like to bring our partners into this. And so for this project in particular, we have very smart people that are standing behind me. Dr. Reese, Dr. Sadler, Dr. Uphold, if you want to just introduce yourselves really quick, these are going to be key individuals that we're going to be utilizing because, number one, they're researchers who know how to identify best practices, best systems for gaining data, and then Dr. Reese actually works pretty closely with the EMS system, so I think this team in particular will really be able to get a good lay of the land, get an understanding of what's going on, and then be able to provide recommendations. So Dr. Reese, if you just want to introduce yourselves and share some info.
Sure. Ryan Reese, board certified emergency and fellowship trained and board certified EMS physician, providing some EMS physician input to the design and implementation of this program.
Hi folks, Richard Sadler. I'm an associate professor at Michigan State's campus right downtown here in Flint. I'm a medical geographer by training, and I'll be working, I'm formerly the director of the methodology core of an NIH center that was headquartered here in Flint, the Flint Center for Health Equity Solutions, and I'll be working on the data sides of this project, including some GIS analysis.
Right, I'm Heather Lynn Uphold. I'm an assistant professor, also at Michigan State here in Flint. My research is in community-engaged dissemination and implementation science. So I take all of the data, all of the work that these guys do, and I put it into ways that we can communicate it with different audiences. So this is a great project. We're all super excited about improving the community that we live and work in.
And I will say we've slated about 12 months for our project. We have it defined into 3 different phases. What's nice is that we're not completely starting from scratch. We were actually able to identify an assessment that other communities have utilized to kind of get a good idea of what's going on within their EMS systems. So within the packet, our full proposal is included, but we are prepared to kind of utilize this assessment as probably like the best tool available for us to try to collect as much information as possible. I didn't know if you wanted to share anything else about the tools or our data collection process.
We sure can, because something that Dr. Brown brought up was this idea of triangulation of data. So getting information from multiple different sources. And that's really what this model that we identified is going to help us do. So we aren't just going to one perspective or one source for information. We're really going to be pooling everyone's experiences, and we'll be doing that through focus groups, interviews, surveys, as well as document reviews. So it's what we're hoping is that we will be able to provide a comprehensive picture of the landscape of EMS services. Anything else for you?
Well, thank you very much, Jim and staff.
And I will say one quick thing, we are prepared. One of the discussions we had in the study session was being able to provide updates, whether it's monthly, quarterly, really whatever the commissioners are in need, just to kind of understand where we're at in the process.
Commissioner Cousineau.
Yeah, I want to thank you, and I'm excited about bringing you guys on and getting your expertise. This is something I've been pushing for a while, quite a while, and it's finally coming forward. You know, as the animal control people were up here a little while ago, we deal with a lot of the social media, and Senator Hanenak, you know that, how that works. And there's all kinds of negative reasons for that, but to bring your data, and you know, and I know Dr. Brown in particular loves that data stuff, and I appreciate that. But I'm looking forward to the results. I tend to get a little antsy in life, and you know, I hate waiting 12 months. I want it now.
It'll go fast.
But I know that you know, I'm looking forward to you bringing the data and recommendations, and whatever you recommend, I know I'll be pushing to move those results. So, thank you.
Okay, Commissioner Avery.
Yes, and Jim, also, some of our respective districts may have questions. I wanted to make sure that maybe someone would be available if we want to have them and get some information, accurate information, because I don't want to be, you know, cause any injustice to what you're doing. So that's be available, that'd be great.
And of course, also, if there's folks that come forward that have perspective, you know, in the whole, you know, in the spectrum of services, we want to make sure that we would talk to them.
Absolutely.
So they're definitely, we want that. If someone felt that they haven't been spoken to, we
Appreciate it. Thank you. Thank you.
Commissioner Brown.
I just want to thank Mr. former, thanks, Jim. Thank you, Jim, and your team for coming forth. I have complete confidence in the methodology and the staff that you have in putting this together. I'm especially excited about improving the EMS system. And so I was happy to see an implementation scientist on your team because so often we do research and sometimes it sits on the shelf and, you know, you have plans and it sits on the shelf. And so implementation is key and very important because what we want to see as a commission is continuous improvement for EMS services for residents in the county. And so I look forward to, I have to be patient. Patience is not one of my virtues, but I do know that good research takes time. And so I appreciate getting updates along the way, and I too look forward to the results.
Any further questions?
Sure.
Mr.
So
Wade.
thank you, Jim and team. Nice to see you, Dr. Uphold. It's been a long time. Yeah, it has been a long time. So just to distill for folks watching and folks who may hear about this discussion, no action to change anything at the moment from this commission. We are asking you to do an assessment looking at the EMS system and all of its parts and complexity, because it's very complex and decentralized in many ways. We're hearing from constituents that it takes too long for an ambulance to get to my home. So that's one of the obvious issues. So we as a commission are giving you resources so that you can examine it, come back with information about what it looks like, how it's working right now, so that we could potentially make future decisions. Is that a fair distillation of it? So thank you, I appreciate it. And then a question to Mr. Freeman. I know that there was a document that I think you all probably presented at a study session that outlined the scope of work and a timeline. Is that document available to the public?
It is. It's included in the packet, which is on our website. The timeline is a little bit off now, just from when it was proposed to when we're actually adopting it, but the scope of work is there.
Yeah, so I would encourage interested people not only to contact the Health Coalition or their county commissioner, but also to take a look at that source documentation that's up on the website. Again, thank you. Looking forward to seeing and reading and hearing what you come up with.
Thank you.
All right. Thank you. Thank you, Ms. Jim. All right, moving on to, I'm sorry, we need to vote, don't we? All in favor, aye.
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 Opposed, nay. Ayes have it, motion carries. Next, Resolution 2024-017, approval of an agreement between Genesee County and the Genesee County Medical Control Authority in an amount not to exceed $125,000 annually to provide for operations of the Genesee County Medical Control Authority.
I'll move it.
This agreement is from October 1, 23 through September 30th, 2026. Been properly moved and supported. Any discussion?
Yeah, Mr. Chair, if I might, this is connected to the previous matter, at least in my district, in that there's strong concern about emergency medical services and whether the commission is fully supportive of emergency medical services, in particular in the form of the control authority. So I'm supportive of this. It provides their operating budget, so there will be no cuts to services, no cuts to programming, no cuts to staff. It doesn't fully fund what the request was, but there was additional dollars in the request for building up their fund balance. But I've talked with Bruce Trevithick a number of times, and I think Josh relayed this to everyone. They have the ability to come forward and make an additional request if there are expenses that are unforeseen, namely trying to figure out a succession plan for Bruce's position, something that he's been doing for quite some time. There's a desire to have an overlap between him as he eases out of the position and a new person. So they may come before us in a year or two, whatever, asking for that. Obviously, we got to get 5 votes or more when they come with that request. But I want to make it clear to people that they're being fully funded in terms of their operating request, and they're able to perform, I think, a very valuable function for the county.
Thank you. Any,
I think one other point is that for the first time since I've been here, this is a multi-year agreement, which helps to stabilize their funding outlook as well. So previously, we did this on a year-to-year basis, and this is for a 3-year contract that, like I said, helps them to kind of see what the future is going to be rather than worrying from year to year.
any, Marty?
Yeah, I just wanted to, tag on to what Commissioner Wayhill just said. As finance chair, Bruce, I never pronounce his last name. I call him Alex Trebek. But at any rate, I had a long discussion with him, and we talked about that moving forward. And we didn't want to cut anything of their requirements or their various different training that they have. We made sure that they got everything that they needed. And I assured him that as they transition to a new director with Bruce's retirement, that all they had to do was come to us, and we would help them out with that at that point in time. And so this puts to rest a number of concerns that's been out there in social media, and I'm happy that we got a 3-year agreement. Thank you.
Any further discussion? Okay, hearing none, all in favor, aye.
Aye.
Opposed, nay. Ayes have it, motion carries. Resolution 2024-022, approval of an agreement between Genesee County and Genesee Health Plan in an amount not to exceed $5 million to allow Genesee County to provide a healthcare service delivery system for uninsured low-income residents of Genesee County. The cost for this agreement will be paid from the health services millage.
So moved.
Support.
Properly moved and supported. Any discussion? Jim, can you come up and explain to the board and to our listening audience what this is about?
Good morning, Commissioners. Morning. So this is, we've had an agreement now with the county for 17 years, and been providing this healthcare coverage to the uninsured, and it's supported by the healthcare services millage, and I think that's up in a couple of years. And so I'll welcome an opportunity to talk with the commissioners on what that would look like moving forward. So it really provides a healthcare delivery system, as is in the resolution. We have a network of over 200 primary care physicians, 200 specialists, so a person who is uninsured can go really to any doctor or clinic here in Genesee County. So it really reduces disparities, and that people can really go and get the care. And we talk about establishing a medical home, so they are able to do that. So I don't know if there are specific questions from the commissioners.
Any questions?
May I just ask one?
Commissioner Wayhill.
Thank you, Mr. Chair. Do you have a map with data points of across the county of people that receive benefits from this that commissioners could look at, so that we're able, so a map, but also I think a raw count, or however you calculate these things, so that we know within our districts how many folks are benefiting from your services?
So what we can do is provide that on a zip code basis. It's interesting you mentioned that, because Dr. Sadler is here from Michigan State University, and he did a project for us a few years ago about where historically our population has been. So it might be something that we could engage them with as well. If you're looking for those beautiful geo maps that are very enlightening, but we can certainly break it down by zip code, and there's some overlap, but maybe that's something we can work with some partners
I would
on.
love to see that. I think that there's a narrative, which may or may not be true, that most of these types of services are concentrated in certain geographic areas, but my intuition tells me that we serve a much broader geographic area with healthcare services, but with all sorts of other things that we offer in terms of human services and health kinds of things.
Well, it has it inverted. So for the first 10 years of the plan, before the Medicaid expansion that occurred in 2013, 2014, a lot of our service, or a lot of our members were in Flint itself. And now that they have Medicaid, a lot of them have access to Medicaid, then it has now branched out into the environments surrounding Flint. So it has changed over the course of time. And so, again, we do have a map that would show that. So I would be happy to show.
And whatever you have and others may have, don't just send it to me, but send it to the entire commission or send it through the county administrator, because it's always good for us to have a grounding in basic data so we can make good decisions. Thank you.
You're welcome.
Commissioner Brown.
I echo Commissioner Wayhill's comments, because I would like to also see how the services are, distributed across the county. My question has to do with, to what extent does the healthcare service delivery system focus on prevention? Can you talk a little bit about prevention for low-income families?
Absolutely. So I think that can be divided up in a number of different ways. We're very involved and partner with the Genesee County Health Department on immunizations, and so making sure that people have access to those and are getting, whether it's a COVID booster, COVID shot, or shingles, or any of those, pneumonia. So that's one preventative services. We also work, to make sure people are getting their mammograms and pap smears. So we are the place in the county. We took over for the health department probably about 5 or 6 years ago, where women who need those that don't have the means to pay come to us, and we make sure that those services can get done, and then we can fast track them on Medicaid if they need to, if there's something that's diagnosed for those screenings. And then, again, we really follow some of the other health plans and medical community on things like colorectal screening and emphasizing those types of preventative services, so that we're making sure that our members are really getting those screenings, so that again we can prevent more serious injury. And a lot of what we do also is in the health education field. So we have health navigators that really work on those prevention model. We try to make it that medical home model and not a emergency room model or urgent care. And that's a lot of people just want that quick care, and there's a lot more to healthcare than that. And so we really emphasize, what are you doing? Are you doing your yearly exam with your physician, and getting those screenings that you need to get, and so forth. So those, I don't know if that answers your question, but we really emphasize the prevention model in us.
Yeah, that does help answer the question. I asked because I'm trying to look at being more healthy myself, and I happened to be on a Zoom call last night with about 90 other people, and there were some physicians out of Chicago, a nonprofit in Chicago, that did the Zoom call, and they answered every single question from every single participant about healthy eating. There was no dumb question. And all of the physicians, it's a series of actual, webinars that was totally free because of this nonprofit. And I think something like that is easily accessible, that someone doesn't have to drive to, they can access it from their computer and still learn how to eat healthy, and have buddies in the system to help encourage them how to stay healthy, and get expert advice from the 200 primary care physicians you have in your system. I think that can do wonders, perhaps, for prevention in our county.
Great. I will note that I certainly wouldn't be one to talk about healthy eating, so I would need that information. So yeah, I think that, and I could also work with the Genesee County Medical Society on that issue. I know the Health Coalition staff is here, and they do a great job on Commit to Fit. So I think there's some opportunities here for our community to look at some of those eating healthy and so forth. So
Thank you.
Any other questions? If not, thank you very much, Jim, and thanks for the work you do. Okay, all in favor of the motion, aye.
Aye.
Opposed, nay. Ayes have it, motion carries. Resolution 2024-040, approval of a request to accept carryover Great Start Readiness Program funds and authorize expenditures in the amount of $107,494.
So
So
moved.
moved.
Properly moved and supported. Any discussion? Hearing none, all in favor, aye.
Aye.
Opposed, nay. Ayes have it, motion carries. Item 2024-041, approval of modification number 4 of an agreement between Genesee County and Oakland Livingston Human Service Agency in an amount not to exceed $107,145.21 to provide programming for Genesee County's Great Start Readiness Program.
moved.
Support.
Properly moved and supported. Any discussion? Hearing none, all in favor, aye.
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 Opposed, nay. Ayes have it. Motion carries. There's no other business before this committee. This committee stands adjourned.
Okay. I'd like to call this meeting to order at 10:16. Roll call, please.
Commissioner Lloyd? Commissioner Winfrey?
Here.
Commissioner Ellenberg?
Here.
Commissioner Brown?
Here.
Commissioner Avery?
Here.
Commissioner Shoemaker? Commissioner Kuzma?
Here.
Commissioner Davis? We do have a quorum.
Okay. Approval of the minutes of November 8th.
So moved. Support.
Been moved and supported. Any discussion? Seeing none, all those in favor?
Aye.
Opposed? Motion carried. Is there any public comment? Any public comment to the board? Third time, any public comment? Seeing none, public comment closed. No communication?
None.
No old business, new business. Resolution 2024-003, approval of a purchase order to CXT Incorporated for the fiscal year ending 2024 in the amount not to exceed $79,251 to provide for the purchase of accessible double vault style restroom. The cost of this purchase is budgeted and will be paid from the account following.
So
Got
moved.
a motion and a support. Any discussion? Seeing none, all those in favor?
Aye.
Opposed? Motion carried. Resolution 2024-007, approval of a request by Genesee County Information Technology to travel to the 2024 NACO Legislative Conference and a CIO Forum in Washington, D.C. Total cost for the CIO not to exceed $3,210. Funding for the request is budgeted and paid from certain account.
Support.
It's been moved and supported. Any discussion? Seeing none, all those in favor? Aye. Opposed? Motion carried. Resolution 2024-008, approval of a purchase order to various vendors for the fiscal year ending 2024 in the amount not to exceed $63,000 to provide for purchase of tires at Genesee County Motor Pool.
So moved.
Been moved and supported. Any discussion? Seeing none, all those in favor? Aye. Opposed? Motion carried. Resolution 2024-026, approval of a purchase order to Delta Railroad Services for the fiscal year ending 2024 in the amount not to exceed $83,000 to provide for purchase of one reconditioned narrow gauge tie crane. The cost for the purchase will be ordered and paid from this following account.
Support.
It's been moved and supported. Any discussion? All those in favor?
Aye.
Opposed? Motion carried. Resolution 2024-031, approval of a restrictive covenant for the motor pool property.
So move.
Been moved and supported.
Support with a question, what is that?
Okay.
Do you have the details on it or no? It deals with the fuel dispensing there. Because there was a leak on the property, they're requiring that we record that in the deed. So if we ever sell that down the road, people would know. Is that right, Ray?
Like a disclaimer?
Yep.
Okay. Okay, any more discussion, Mr. Kuzno?
Yeah, that's pretty much just a state mandate, isn't it, Brian?
Yeah.
Any further discussion? Seeing none, all those in favor?
Aye.
Opposed? Motion carried. Any other business? Seeing none, this meeting is adjourned at 10:18.